Well, the Prime Minister has been visiting Assam today, and he said that the spirit of Sabka Saath and Sabka Vikas was propelling the central government in finding solutions for border-related issues. The recent agreement between Meghalaya and Assam to resolve a 50-year-old dispute would serve as encouragement for other states, he said. He also laid the foundation stone for a number of projects relating to healthcare and education in Dibrugarh, Karbi Anglong. He highlighted the initiatives taken by his government to ensure peace and development in the northeast.
It is a day that raises Assam to a higher level in terms of health care and treatment of cancer that has not been experienced by the other states in the country. It really is a day that cancer, which is not a rich man's disease, is being equipped to serve and treat the millions of people that are inflicted.
Ratnadeep joining us with the latest. Ratnadeep, Ratan Tata there, of course, speaking at the inauguration of one of those major healthcare centres. But, what have been the big takeaways from what the Prime Minister has said today?
Well, the big takeaway from what the Prime Minister has said is perhaps the Prime Minister is trying to pitch his development model for the Northeast. Remember, in the first rally that he held at Dibrugarh in Karbi Anglong, he spoke about how there has been a steady decline in insurgency in the region, and that had resulted in actually, a reduction of areas in Northeast under Armed Forces Special Power Act. And so he feels that this is a major success of the BJP government, both in the state and center. And in Dibrugarh, where he held his second meeting, where he actually inaugurated 7 cancer hospitals and laid foundation stone of 7 others, he said how his government is trying to, build in this model where, this chain of cancer hospitals are going to be a model, because it is country's largest public-private partnership, where the Tata Trust has come forward to partner with the Assam government to come up with this chain of cancer hospitals, and how things have changed over the years ever since the Modi government came in power in center. And he gave example how people used to actually had to go for minor ailment outside the state, outside Assam and outside Northeast to the metros like Delhi, like Mumbai for healthcare, and how things have changed, how more medical colleges have come up in the region in this 8 years that PM Modi has been Prime Minister. So clearly, Prime Minister pitching the development model, and this at a time when the Himanta Biswa Sharma-led government in Assam is going to complete 1 year, and there are elections in 3 crucial states in the Northeast next year. So therefore, the Prime Minister now trying to pitch this model of better healthcare and reduction of Armed Forces Special Power Act areas in the Northeast.
All right. Thanks very much indeed, Ratnadeep. Let's also listen into what the Prime Minister had to say.
आज यहां असम के 7 नए कैंसर अस्पतालों का लोकार्पण किया गया है। एक जमाना था 7 साल में एक अस्पताल खुल जाए तो भी बहुत बड़ा उत्सव माना जाता था। आज वक्त बदल चुका है। एक दिन में एक राज्य में 7 अस्पताल खुल रहे हैं। और मुझे बताया गया कि 3 और कैंसर अस्पताल आने वाले कुछ महीनों में तैयार हो जाएंगे आपकी सेवा में।